Hello, I am Dr. Thekedath Matthew. Today I am discussing heart attacks. I was wondering why heart attack is missed in the diagnosis by everybody, the family, the emergency room physician, and even the cardiologist. What are the mysteries involved in cardiac arrest? I'll present one case for you to understand. This is the story of a 45-year-old Kodak engineer who developed burning sensation in the chest by about 10 o'clock on a certain day. The burning sensation increased by the hour. By 2 o'clock, they have already taken several tablets of Tums and 2 tablets of Prilosec under the direction of his wife, who was working in the emergency room in a nearby hospital. By 3 o'clock, he developed a profuse sweating, diaphoresis, and we wobbled and fell down to the floor. There was a 13-year-old boy in that house. He was frozen. He did not do anything for the next 10 minutes. And then he called his mother. His mother from the hospital called 911 and also Dr. Matthew. The 911 people came to the house after 9 minutes. That is 9 plus 6, 15 minutes later, the paramedics came, they started CPR, and they defibrillated. Now, I need to explain to you what is defibrillation. In a normal heart, it is called normal sinus rhythm. If I animate it like that, it is something like tudum, tudum, tudum. And if I take the EKG, I will show you the normal sinus rhythm, and then I will show you the conversion to a ventricular fibrillation, and then after cardioversion, putting back to normal sinus rhythm. I will explain. This is normal sinus rhythm. Tudum, 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 tudum. At the onset of heart attack, in some people, that tudum changes. Tudum, tudum. In such situations, we can use a small little machine called AED, and when the AED is connected, it will tell you to shock. When you shock, I will animate it something like this. Tudum, 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 tudum. Dum, tudum, tudum, tudum. Now, this is done by a small little machine called AED. AED is part of basic life support. When you put the electrodes to the chest, one on the front of the chest and one on the back of the chest, this AED will talk back to you. It will say shock or no shock. Based on that prompt, you can work. Let us go back to our patient. The paramedics came. As I had animated, he was in ventricular fibrillation. They defibrillated him and put him in the emergency room. In the meantime, I had already in the cath lab in Rochester General Hospital, I had mobilized the cath lab team and we were ready, but the ambulance did not come. I waited for 15 minutes, the ambulance did not come. I went to the emergency room and I heard that the patient was taken to the nearby hospital and they intubated. So by 4:30, that is 40 minutes after the episode, the patient came back to Rochester General Hospital. In 15 minutes, I did the angiogram. I found out the blockage, and let me make a quick trip back to medical school for your better understanding. The heart muscle is the main pumping chamber of the heart. It is supplied by coronary arteries. This is the schematics. This is the heart muscle. This is the coronary artery. They are sitting on that heart muscle like a crown. Therefore, they are called coronary arteries. When I make a schematics or a diagram, this is the right coronary artery and this is the left coronary artery. I have drawn some blockages there too. Now, when you do an angiogram, a left coronary artery will look like this. In our patient, the engineer, he had a blockage right there at the very beginning of the LAD, left anterior descending artery. That is called a widowmaker. So this patient had a widowmaker blockage there. This is the right coronary artery in a normal subject. Going back to the patient, patient arrives at RGHED by 4:15. Angiogram was done, but we have to note that the patient was breathless for 16 minutes. Now, this is the artery of that engineer. When I did the angiogram, there were a lot of blood clots or thrombus. I have aspirated them. This is the angiogram after the aspiration. There is residual stenosis. I have to put a stent and I put a stent. What is a stent? A stent is a metallic mesh mounted on a balloon. This balloon can be taken into the inside of the heart, inside the coronary arteries, where the blockage is. The balloon can be expanded, then this mesh wire will unfold and then scaffold the blockage, and you will see a very fine opening at the end. In our engineer's case, I did a stent there. The stent is extending from there to here. This is the place of that blockage. The blockage disappeared. But the heart muscle get blood supply by two coronary arteries, the left and the right coronary artery. If the heart muscle is devoid of blood supply for 20 to 30 minutes, the heart muscle dies, and that is a heart attack. Now, after stenting and establishing forward flow, the patient did not wake up. He did not wake up the next day, the following day either. EEG, electroencephalogram, showed sluggish activity of the brain. The next day, EEG showed straight line, and on the fourth day, we pulled the plug and the patient was dead. This patient developed a condition called sudden cardiac death. What is sudden cardiac death? It is the unexpected abrupt cessation of cardiac function, typically due to ventricular fibrillation. Earlier on, I animated ventricular fibrillation. Ventricular fibrillation is a mortal condition. If it is not defibrillated by that little machine AED, all the patients will die. So, if the brain is devoid of blood supply for 5 minutes, the brain will be dead. You remember in our patient's case, he was on the floor for 16 minutes. So, in the first 5 to 6 minutes, brain death has already occurred. Then why did Dr. Matthew put a stent? Because I am not sure whether the brain death happened. Some people will take an occasional breathing and they die. These are some of the faces, famous faces in the Hollywood. You can identify their names. They are all dead before the age of 55 with sudden cardiac arrest. There are many faces: Lisa Marie Presley and Suzanne Summers, and this is a famous Miss Universe, Sri Devi from India. She sustained cardiac arrest at the age of 51, and this is an interesting slide for the Indians. These are the legends in the Indian music industry. Mohammed Rafi collapsed at the age of 55. Kishore Kumar collapsed at the age of 55. Mukesh collapsed at the age of 53. Saigal collapsed at the age of 42. This guy collapsed when he was doing a concert in Chicago. And likewise, there are hundreds and hundreds of people dying all across the world with sudden cardiac arrest. Now I'm going to show the animation of that engineer. This is the engineer's heart when he was 20 and 30 and early 40 years. Cholesterol crystals are going from the proximal end to the distal end. At some point, the cholesterol crystals will gain access into the intima of the vessel and get in there and create a plaque. The foam cells coalesce together and produce a fatty center, this liquid fat. This is a plaque, but the patient will not know anything about it because he has got a lumen of 60% open. If he goes to a cardiologist and if he does a exercise test, still it will be normal, but at some point it can produce problem. This fibrous cap can produce a small little cleavage. The weeks and months before this episode, this engineer's heart was like this, but he had a liquid plaque, nobody knew. And then there is a small little cleavage happens. When this cleavage happened, this engineer developed burning sensation in the chest. And this went on for about 3 to 4 hours. And at a certain point, the liquid fat will flow down into the lumen and there will be instantaneous blood clot. Then the flow from the proximal to the distal end stops. The patient wobbles and wobbles, but darkness getting into the eyes, and he becomes totally flaccid and go to the floor. Now, when it happens, if it happens in your vicinity, what you need to do is cough, 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 call for CPR, call for defibrillation, call for ambulance, continue cough, cough, cough. What is cough doing? Cough is internal CPR. This is one and only slide in the world where you see a pressure reading from inside the aorta on a patient. When I am doing an angiography, he developed vasovagal attack. His blood pressure dropped from 170 to 104. I told him, cough, 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 cough. Then you can see the blood pressure is rising, and that is good enough for the brain. And this cough, cough, cough can go until he become obtended. In the meantime, you can initiate CPR. Now, since when heart attack happened to humanity is an interesting question. Our ancestors were keen observers of human afflictions. They did excellent narrations of diseases in all our ancient books called the Egyptian, Babylonian, Indian, Chinese, Greek, Old Testament, New Testament, etc. But there is no mention of a chest pain in any of our books. In the Indian Rigveda, Yajurveda, Chinese documents, Babylonian documents, but this is Ashtanga Hridaya. There's an Indian document, but don't mention. One Egyptian document in 1550 BC, there was one mention of chest discomfort, which is considered to be a presentation of chest pain, but nothing more than that. No other descriptions anywhere. So, since when the issue of heart attack developed for humanity, you have to think about it. I think it happened since the first description by Sir William Heberden on July 21st, 1768, in the Transactions of the Royal College of Physicians of London. In that report, he said, there is a certain disease of the breast characterized by a certain sense of most disagreeable pain, severe shortness of breath, impending feeling of death, as if a noose is tightening on around your neck. Your breathing becomes difficult. You wobble and fall down to the floor and die. And that is the first description of a heart attack in human history that happened about 250 years ago. Now, implications of this description: almost everybody in the world knows that heart attack is a severe condition with severe chest pain, etc. So that became misleading for all of us. So there are many mysteries in heart attacks. As I said in my opening statement, many heart attacks are missed all across the world. Mystery number one: a person with no symptom goes to bed, do not wake up. Proof of a heart attack from autopsy. No symptom. He goes to bed, he doesn't wake up. Mystery number two: chest pain, chest discomfort with exertion, off and down. One day with no provocation, severe shortness of breath, sweating, chest pain, collapse and dies. This mild chest pain, you should get the clue or the cue and you should have acted on it. Mystery number three: some left arm discomfort, no chest pain, maybe some mild shortness of breath, one day rapidly deteriorating into shortness of breath, pain, and death. Then there is the classic presentation, as I described. I told you about Sir William Heberden's description. That is the classic presentation. So all the human beings virtually believe that this is the only presentation of heart attack. Mystery number five: burning sensation in the chest, may go on for hours. Suddenly, severe sweating and shortness of breath, collapse and die. This is exactly what our engineer had. Mystery number six: in women particularly, no chest pain, no shortness of breath, some flu-like symptoms, quickly deteriorates into shortness of breath, sweating and collapse and die. This is mystery number six. Mystery number seven: again in women, pain in between the shoulder blades in the back deteriorates into shortness of breath and chest pain. Again, mystery number eight in women, some jaw pain, then shortness of breath and chest pain. Number nine, no chest pain, no shortness of breath, but feeling drained, and then develop shortness of breath and die. The perception that heart attack will start with chest pain, gradually progress into severe chest pain, and we will get a chance to call 911 is wrong. So you have to think about all those nine things that I said. They are the mysterious manifestations of heart attack. Now, that is the reason why it is the biggest miss of all. This is the reason why heart attack is missed by the patients, the family, the doctors, and even the cardiologist. So I say to you, you, the patient, must be the first one to make the diagnosis of heart attack. You should make your diagnosis of heart attack. I'll repeat for a third time. You, the patient, should make the first diagnosis of a heart attack. For that, you should know the various mysterious manifestations of heart attack as I have described before. Now, there are many stigmas. Some will say, I thought it was gas, but it was really a heart attack. Others will say, it was not anything much, mild chest pain, they neglect. Others will say, I don't want to wake you up, so I lay down to see what happened. And others will say, no matter what we do, whatever has to happen will happen. This dictum, this one, is a curse particularly among Indians. Some of the ancient sages of India have made this dictum: don't worry, you believe in God, whatever has to happen will happen. And during those days, the longevity of life was 30 years. But they believed whatever has to happen. Many people, even physicians, I know even a medical college principal who did not go for angiogram and investigations because he knew whatever will happen will happen. I know many cases where intelligent people, educated people, getting symptoms of chest pain but will not go to the doctor because they know whatever has to happen will happen. Now, a well informed patient has the best chance. You should have an idea of your chances of getting a heart attack. The presentations are very confusing, the presentations are misleading. You can die of a sudden cardiac death even without knowing that you have a heart problem. You can imagine the mysteries of heart attack. Many people ask, what is my chance of getting a heart attack? It's a very interesting question. I have created an answer for you. First, if you have a heart, you can get a heart attack. As simple as that. Every people who possess a heart have the potential to develop a heart attack. If you are age 40 and above, the chance increases. If you have diabetes, increases further. If you have hypertension, increases a little more. If you have family history of heart disease, a lot more. If you smoke cigarette, more. If you have high cholesterol, even more. If you have an apple butty, even more. So if you have 5 of these cardiac risk factors, by the age of 55, you have a 50% chance of getting a heart attack. 5 cardiac risk factors, if you have at the age of 55, you have a 50% chance of getting a heart attack. If you get a heart attack, you have a 60% chance of dying with the first heart attack. So, what you do if you are around? Cough, 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 cough. I showed you one very rare slide of what cough does as internal CPR. CPR, CPR, CPR. So you have to understand, without training, you will not get the presence of mind to start the CPR. You remember the boy, 13-year-old boy, he was frozen. Number 3, simultaneously call for help 911. 4, continue CPR until AED and paramedics come. CPR is a bridge only. AED and defibrillation is the lifesaver. So, let me see. If you see somebody falling down, you tell him to cough, 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 cough. And if there is no pulse, you started CPR, CPR, CPR. While you are doing the CPR, you call 911 and tell somebody to keep the front door open, and you continue the CPR until the AED and paramedics appears. The CPR is only a bridge. When the paramedics come, they will defibrillate the patient to put to normal. So, loss of 16 golden minutes happened in this case. Patient was on the floor for 16 minutes. By the time brain has already dead. Brain cannot survive without oxygen for more than 15 minutes. So, ladies and gentlemen, myocardial infarction is one of the most difficult diseases to diagnose. In United States in the 1980s, closer to 1 million people used to die. But with many interventions, the rate of mortality in the United States right now is 225,000 altogether, or 25,000 per million. So we have made lot of improvement, but lot of improvements have to be made. Therefore, make an attempt to study the mysteries of myocardial infarctions. Thank you for listening. Wait for my next video.